all genocide is also, I would describe it as inherently eugenic in its consequences, in that the weakest always perish first, right? Those who are disabled, those who have the most need, those who are the oldest, the sickest, those who are physically weak are going to be those, and so only those who are the most physically resilient can possibly even hope to survive under these conditions, which adds, I think, another level of grotesqueness to the genocide.
Yes, and we've all seen the images of these skeletal infants and children, severely malnourished, and particularly those, as you mentioned, those with pre-existing conditions die first. Dialysis patients die first, diabetics or people with other chronic illnesses that can no longer get medication die first. And while I think the focus on children is entirely legitimate, they are, the most vulnerable members of society. It often diverts attention from another group of people who are equally vulnerable, and those are senior citizens and the elderly. We very much less often hear about them, and they are often in exactly the same situation as infants and young children. But given their age, they often also have either chronic conditions or mobility issues and so on. And I think the focus has often been diverted from this crucial population group as well.
And of course, the disabled. And there are many
Yes.
people in Gaza who are disabled after previous rounds of Israeli
Yes.
bombing.
Yes, and the Gaza Strip now apparently has the highest population per capita of child amputees. One of the real one of the real scandals of this entire genocide is that in addition to let's say those who have been mortally wounded and killed by Israeli attacks, there's a very large group of people who, under normal circumstances, even given the state of the health infrastructure in the Gaza Strip before October 23, these are people who, under normal circumstances, could have been saved because their injuries were not necessarily life-threatening. But given Israel's systematic destruction of the health infrastructure in the Gaza Strip, its killing of over 1,500 health professionals, its bombing of every single hospital and clinic in the Gaza Strip, its prevention of the entry of basic medical supplies to the extent that children have to be amputated without anesthetic and so on. There's a very large group of fatalities in the Gaza Strip who, under normal circumstances, could have been saved and still be among us.
Well, that's such a crucial point because, and it relates to a post that you made last month about the death statistics and the way they're reported in the U.S. press, where what we read is, I think the official number is still in the 50 or 60,000 range of violent deaths, and in the U.S. press that's always reported as coming from the quote unquote the Hamas-run health ministry, and whenever people didn't say
Hamas-run Hamas health Hamas ministry,
yeah,
yes.
Hamas, right. And whenever people didn't say that, there was immense pressure. Oh, you must say the Hamas-run health. The implication of that being that it's possible that the death statistics are an exaggeration.
Propaganda.
But we spoke to Dr. Feroz Sidwa, who's done excellent work in Gaza, testified before the UN, and sent a letter on behalf of Gaza of medical practitioners. And they said, far from what Joe Biden alleged, which is that they're exaggerating the death statistics. Actually, the official death statistics from the Hamas-run health ministry are a massive undercount. I mean, they are really they really do not nearly capture the number of deaths that have been caused by this conflict. They don't capture the number of violent deaths, and they don't capture all of those deaths that you were just talking about there, deaths that would not have occurred if it were not for this.
The point I sought to make in my post is, Hamas-run health ministry is problematic because it gives the impression, that every doctor, every nurse, every ambulance driver in the Gaza Strip is somehow, Hamas militant. But having said that, Hamas does rule the Gaza Strip. It does exercise hegemonic control over the government of the Gaza Strip, or at least did. And it does appoint the Minister of Health. So, arguably, for journalistic purposes, Hamas-run health ministry is an acceptable is an acceptable description. But if you're going to do that, then the same criteria should be applied to others. For example, why don't we hear about the Shas-run Israeli health ministry? Why do we never hear about Benjamin Netanyahu, the international fugitive wanted for war crimes by the International Criminal Court? But most importantly, when you only mention the political affiliation of the health ministry in the Gaza Strip, and you present it as a way to kind of minimize or dismiss its credibility, then I think it's also incumbent to examine the actual record and the established credibility of this health ministry. And here the record is very clear. There have unfortunately been multiple previous Israeli onslaughts on the Gaza Strip. And in every case, professionals who have looked at its data and statistics after every previous Israeli attack have found that their statistics are credible and accurate. In fact, both Israeli and US intelligence use the figures of the Gaza Health Ministry in their own reporting. But this is always left out. All we're ever told is Hamas-run health ministry, as if somehow because of that very reality, its statistics are not credible. And as you mentioned, given these are very professional people who will only record a casualty in their data set if they're given a name, if they are given an identification number, if they can confirm that this person is actually dead. So if a Palestinian is stuck under the rubble for the last 8 months and hasn't been able to be confirmed as dead, they're not included in the health ministry statistics. The health ministry statistics do not include indirect deaths, such as those we were previously discussing. And just as importantly, the same media, when discussing claims by the Israeli military, never point out that this is an institution that has a well-established record of systematic prevarication, of lying on a daily basis about anything and everything that has to do with the Gaza Strip. So, their integrity and accuracy is never interrogated.
You reposted on Twitter recently some the Palestine Trauma Center in Gaza compiled questions that children in Gaza have been asking, and they are very disturbing, but they are exactly the sort of things that you would imagine children would ask. Do kids who have their legs amputated grow new legs? Do I have to die in pieces? Will we burn when they bomb the tents? Why do they drop the bombs? When will the war end? And I appreciate that you reposted that, because I think that it is. We do too often discuss things at the highest level. We discuss negotiations. We discuss the political aspects of the conflict and the actual. And even when we discuss children, we don't hear from the children. We don't. The actual voices of Palestinians are still really, really absent. Even as U.S. public opinion has fortunately shifted on Israel over time. I think there is a much broader understanding of a better understanding of the dynamics of the Israel-Palestine conflict among Americans now, but it is quite striking the absence of those voices. Many of those voices, like that of Rafat Al-Arir, the most powerful voices, are silenced violently. But to really understand the conflict, you have to actually hear from the people who are subjected to it.
Yeah, and then when I think it's vitally important to hear particularly the voices of children. These are, individuals who can't be accused of being, senior political or military leaders.
Well, you say
And
they can't, but
well, but they are, of course. Yeah, I mean, in the world of Hasbara, everyone is a combatant, including infants who don't even know they're Palestinian or in the Gaza Strip. But the real tragedy here is that even on those rare occasions where the voices of Palestinian children are featured, they're then suppressed. I mean, the most famous example, of course, being this documentary made for the BBC, which focused very much on how Palestinian children in the Gaza Strip were experiencing the genocide. And then it was discovered, as if this was some kind of mortal sin, that the father of the main narrator of this documentary was an official in the Gaza government. I think he was deputy minister of agriculture or something like that. And this somehow disqualified the entire documentary, and it was pulled by the BBC, and the BBC apologized. And just recently, it came out with a comprehensive report, basically saying there was nothing inaccurate about the in the documentary. There were no problems with the documentary as such, but it was not reported that the chief narrator, a 13 or 14-year-old boy, who's been absolutely demonized and vilified and so on, that the BBC should have made known that his father worked in the government. Well, for God's sake, do you go out of your way to look at the family or extended family of everyone in every documentary and see if they have any political connections and report them? Of course not. I mean, there would have been nothing wrong with reporting where his father worked, but it turned out to be completely irrelevant to the documentary or to anything this child said. Also, because the narration was scripted by the production company, not by the kid or his father. I mean, I could go on for hours about this, and then of course there was another documentary commissioned by the BBC about the destruction of the health sector in the Gaza Strip, which we just discussed earlier in our discussion, and that was then pulled, and the BBC tried to suppress it and basically pretend it didn't exist until Basement Films, the company that produced this, successfully managed to get it broadcast on Channel 4 in the UK and on Zeteo. I mean, an absolute scandal. Palestinian voices not wanted here.
Hope you're enjoying this interview. If you want to listen to full-length current affairs interviews before they are made fully available to the public, please visit our Patreon page at patreon.com/currentaffairs and become a supporter today.